Imagine a world where the very people tasked with protecting your health are actually creating chaos and confusion around a life-saving vaccine. Welcome to the reality of COVID vaccine boosters under the Trump administration, where the first deployment of updated shots has been marred by access issues, misinformation, and turmoil at U.S. health agencies. But here's where it gets even more concerning. The problems aren't just limited to logistical hurdles, but also have significant consequences for public health, particularly for people of color and low-income individuals. The eligibility requirements for the vaccine are unclear, and booking appointments, processing insurance claims, and obtaining prescriptions from doctors have become a nightmare for many. And this is the part most people miss. The chaos is not just a result of bureaucratic red tape, but also a deliberate attempt to discredit scientific experts and create confusion. As Robert F. Kennedy Jr., Secretary of the U.S. Department of Health and Human Services, said, "Anybody can get the booster," but then added, "It's not recommended for healthy people." This mixed messaging has led to a situation where people are struggling to understand who is eligible for the vaccine and how to access it. Matt Shipman, a health writer in North Carolina, is one such individual who has been trying to get the updated shot to protect himself against the risks of COVID infection. However, he received a message saying the vaccines will hopefully be available in a few weeks, and when he called his doctor's office, they wouldn't even make an appointment for a prescription. The situation is further complicated by the fact that some states, like North Carolina, require prescriptions before administering any shots, while others have laws preventing pharmacists from administering vaccines not recommended by the CDC's Advisory Committee on Immunization Practices. The controversy surrounding the vaccine deployment has sparked a heated debate, with some arguing that the Trump administration's policies are harmful and unscientific. Senator Bill Cassidy, a Republican from Louisiana, has called for an indefinite postponement of the vaccine committee meeting, citing the recent upheaval at health agencies. But here's the question. Is the chaos surrounding the COVID vaccine boosters a result of incompetence or a deliberate attempt to undermine public health? As Lindsay Wiley, a professor of law and faculty director of the Health Law and Policy Program at UCLA Law, pointed out, changing the rules to make vaccination easier will depend on the state, and some governors and health officials are solving the prescription problem swiftly, while others may need to take action to fix the problem. The situation is even more dire for marginalized communities who face immense structural barriers in accessing the shots. Julia Lynch, a professor of political science at the University of Pennsylvania, noted that transportation is a major issue, and traveling to get a vaccine can be a significant undertaking, especially for those without reliable internet access or the ability to take time off work. The challenges are not just limited to accessing the vaccine, but also to getting it covered by insurance or paying out of pocket. Rachel, a resident of Pittsburgh, has 2 autoimmune disorders and a genetic blood clotting disorder that puts her at high risk if she gets sick with COVID. But she is planning to wait a few weeks to get the vaccine due to the challenges in accessing it. The situation is a stark reminder of the importance of clear and accurate information in public health and the need for policymakers to prioritize the well-being of all individuals, regardless of their background or socioeconomic status. So we ask you, what do you think is the root cause of the chaos surrounding the COVID vaccine boosters? Do you think it's a result of incompetence or a deliberate attempt to undermine public health? Share your thoughts in the comments below.